I want to respond to this from the perspective of someone who used naltrexone myself to overcome alcohol addiction. I've also been coaching people since 2018, and I work with a lot of doctors who use this treatment. I'm not a doctor. Please always defer to your doctor's guidance. This is not medical advice. One thing before I start that I wanted to mention as well is that if you are experiencing side effects to naltrexone, if you look at the research, and this is true in my experience as well, for most people, the side effects just occur in the beginning and they go away over time for most people as their body adjusts to it. I have a playlist on here where I talk about the research into the side effects and also my experience as well. So the reason that the Sinclair Method protocol has been shown to be so effective for treating alcohol addiction has to do with the fact that naltrexone is taken in a targeted window right before drinking. If you look at the research into this protocol, typically naltrexone is taken 1 hour before drinking. The reason that that's important is because then you have enough of the medication in your system to block the endorphin effects of the alcohol. If you don't have enough of the medication in your system, it's not going to be getting the full blockade. Your brain's going to still be getting some of the endorphin reward from alcohol, and it's not going to allow your brain to properly unlearn alcohol addiction. I've worked with a lot of people over the years who were taking the medication in the morning and drinking at night, or taking it before bed and drinking at night, and they tell me they were on it for a few months, they didn't notice any changes in their drinking, and as soon as they switched to the targeted dose following the Sinclair Method protocol, again per their doctor's advice, they started to see the results. Because what happens for a lot of people, just example, tons of clients I've worked with and me as well, is that the medication wears off the longer it's in your system. So like we have members in our program, if they take the medication at noon, but they're drinking at 7 o'clock, their body has metabolized at least half the medication. And when they drink, they're not going to experience the beneficial effects, which is, again, blocking the endorphin reward from the alcohol. So that's why the targeted dose following the Sinclair Method, if you're using this treatment to drink less and you want to work toward pharmacological extinction of the addiction, which is essentially reversal of the alcohol addiction, that targeted approach to taking naltrexone is really effective for a lot of people. That's the approach I use. That approach has been researched a lot and shown to be really effective for a lot of people. And it's effective because you're essentially taking naltrexone, your receptors are blocked, and then you're drinking, and your brain isn't getting the same level of reward as it used to. And when you do that over and over and over again, over many, many months, the brain stops seeing alcohol as this reward. And when that happens, the cravings for alcohol reduce and eventually go away over time. And if and when someone drinks, they take naltrexone following the Sinclair Method, and they're able to moderate and have control. But if someone, let's say, is taking it at night before bed and then they're drinking the next day at like 5 o'clock or even at noon, just think about the fact that they've metabolized a lot of the medication by then. The half-life of the medication is anywhere from 4 to 13 hours, depending on how quickly someone metabolizes it. So after 4 to 13 hours, at least 50% of the medication is washed out of the system, and at that point, it's not very effective for the Sinclair Method. Now, naltrexone is used in different ways to treat alcohol addiction. Some people take it daily to help with cravings and they're sober. I can't speak to that as much because I don't have personal experience with that, but I do hear anecdotal experiences where people find that taking it daily helps with their alcohol cravings. And so I don't know if that's the approach you're using for your alcohol treatment, and if it is, I would just say pay attention and see if naltrexone, if you're noticing it, help with your alcohol craving. But even still, when people are taking it daily to help with alcohol cravings in order to stay sober, one of the doctors we work with, he typically has his patients take it still close to their usual drinking time. So I was usually drinking at 5 o'clock. If I was working with him, he would probably have me take the medication around 3, 4, 5 o'clock in the afternoon when my typical cravings would become most intense, and naltrexone can potentially work as an anti-craving medication. So I hope that answers your question. The book that dives into all of the research behind the Sinclair Method protocol, which again is just targeted naltrexone before drinking, resulting in pharmacological extinction of the alcohol addiction or reversal of the alcohol addiction over about 9 months to a year. There's a book called The Cure for Alcoholism by Dr. Roy Escapa that dives into all of the research into this treatment. I definitely recommend checking it out if you are using this protocol. And I have lots of resources on my website. I have a private online program centered around the Sinclair Method where we guide people through the protocol step by step. We can also refer you to a doctor if you need the naltrexone prescription. Reach out, the link in my profile, or head to thrivealcoholrecovery.com. Thank you so much.